Hi guys, it's Dr. Selene with BU Medical. I want to talk to you guys today about CoolSculpting. It's one of my favorite body sculpting treatments. Is it perfect? No. So I'm going to talk to you about what it can do and what it can't do. Keep in mind that I am a huge fan of plastic surgery, but it's not always for everybody. So you do have downtime. Liposuction is not painful, so it does hurt a little bit, and it's a procedure, so that's not for everybody. Do you want a lunchtime procedure that's still pretty effective, not quite as effective as lipo, but still quite effective, and then you just come in, work on your iPad, leave, or are you committed to doing the recovery of liposuction? Again, I'm a huge fan of it, both ways, but sometimes CoolSculpting is the modality that you want to go to in this crazy world. So we're all living busy lives, but we all try to eat healthy, exercise, but every now and then there's some trouble spots that all of us have, especially post-mama body. One thing that I noticed was my lower abdomen was really hard to get no matter what kind of exercise I did. Now we're born with a number of fat cells that we're going to have for the rest of our lives. So given that, if I have, say, 1,000 fat cells in my lower belly, those either shrink or grow depending on how much I'm eating, my lifestyle, my activity. So the goal of fat freezing, or cryolipolysis is the fancy way of speaking about CoolSculpting, is that we're freezing the fat to death. Basically, once a fat cell is dead, it does not come back. So if I take those 1,000 fat cells that were in the abdominal area and freeze them, and I always say plan on about 20 to 25% reduction every time we freeze. So if I freeze them, I would decrease my 1,000 fat cells down to 750. If I want to get them down to 500, then I would freeze them again. If I want to get them down even more, freeze them again. So for that reason, in our clinic, the way we run our cycles is I ask almost everyone to at least commit to a 2-cycle treatment per area. Which areas do we treat? Multiple of them. So I'm going to be really honest. You guys know me for that. Not all areas are created equally. So I've seen lots of beautiful pictures online about the arm CoolSculpting and the neck CoolSculpting. I gotta tell you, I don't love it as much as I love the abdomen and bra fat. So the arm is okay. Do I love it? Am I crazy about it? No, not love it or crazy about it, but it's good. It's not amazing, but it's good. And the same for the chin area. Most of the time when I evaluate someone there, I actually think Kybella is better, which is our injectable dissolvent, because it's a small area. And so if you can just inject and dissolve that area, that makes more sense to me versus just freezing 25% of it. But on the big areas, abdominal area, bra fat, banana roll, things that are really hard to get a hold of, there I do feel like CoolSculpting shines. So the way we do it is we put a protective gel over your body to make sure that you don't get freezer burn. I actually had someone back in the day do an off-label CoolSculpting machine from China on me, and I hyperpigmented, and I don't think I was protected from the freezing. So we go out of our way to make sure that you're protected with a little anti-freeze essentially pad, and we put that on the skin to protect it. Then the machine gets put on to the area of concern. It sucks it into like a vacuum, which then freezes that fat. So think about it like a block of butter, basically. When we freeze that area, it becomes a frozen block of fat. And then we do a massage to release that fat and get your body to metabolize that and eliminate that, which is a beautiful thing. Remember that every time we do it, we're eliminating about 25%. You eliminate it just as you eliminate everything else. It takes about 3 months to fully eliminate. So we repeat your repeat treatment at about 4 to 8 weeks after your initial treatment. And if there continues to be problem spot areas, we can continue to freeze those areas as well. So go into it knowing that, hey, if I'm gonna do this lower belly area, I'm gonna commit to at least a series of 2 treatments, and each treatment is about the size of a palm. So just keep that in mind for how big of an area does it treat. Does 1 cycle equal my whole belly? No, typically not. The way I say it is if you're doing your whole belly, it's a 8-cycle treatment because it's 1, 2, 3, 4, and then you repeat that again, 1, 2, 3, 4. And then I plan on repeating that in 4 to 6 weeks. So it's not just a one cycle thing. So when you hear or see advertisements for a CoolSculpting cycle, let's say that's $500, $700 a cycle. We normally have specials on that, keep that in mind. But multiply that by a couple of cycles because it's not a one and done. So remember, it's a beautiful treatment. It is effective. It is not liposuction, but it does give you some fat freezing, fat dissolving results that are legitimate and very visual on before and afters. If you're curious about it, just Google it. Google before and after pictures. Remember, most doctors are going to post their best pictures, including ourselves, so it's not consistent for everything, but it does give you a good idea of what you can expect at your CoolSculpting results, or if you're even a good candidate for it. If you're really overweight and you need to make some diet modifications, I often say do that first, and then use this for your trimming, your focus, the little problem spot areas that are left. So if you're ever curious about it, we have consultations regularly with our MA that is more than happy to guide you through what's a possibility, where will you see results, and what's the best treatment for you. Remember, we want you guys to look great so you can feel great, so you can do great things in this life. Take care, guys. Bye-bye.